This is the video of how to give Stella her popsicles when she's being difficult. So I've got, I'm keeping, in the last video I had this little container of carrots, the cubed carrots in the fridge, but I've been keeping them in the freezer now because they go bad so fast in the fridge. So out of the freezer, you're gonna need your thing of carrots, your popsicles, your medicine popsicles, and a sweet potato baby food. Please make sure your hands are always clean before you give Stella any medication, because any food particles from what you've been eating or that are on the counter, I always try to make sure none of her treats touch the table unless it's been freshly washed, just because her vet said that any small particles of food can make her have a reaction that are not her normal food. So my hands are clean. She has refused to take the popsicle just the way it is. So now I will, and this is kind of the same that I showed in the other video with the regular meds. I was gonna show you that these you wanna be careful about when you're opening because they will splatter on you. So now you've got a good visual. If you can zoom in on my fingers here, I am going to just use two hands and very slowly pull it back so that the air comes out without splattering all over me, because this stuff will stain. So anyway, you get the carrots, and this first round is no medicine, just so we're tricking her into feeling comfortable. She's got a little bit of the baby food on top because that, even without the medicine in there, that is the important part. When we do put the medicine in, that will hide the popsicle smell, because she can smell the medicine inside the popsicle. So now I've got a popsicle and carrots and baby food on top. It tricks her into taking it. I usually do a round without a popsicle in between, just to make sure that she's not gonna start trying to spit things out. You can tell that she's kind of being more careful with what she's taking into her mouth. So having that second round of decoy, no meds, is, I found to be very helpful. So here's her second popsicle, carrots, baby food on top, and she's sniffing it, which means she's being more cautious. I try to cup my hand so that it makes sure she gets that popsicle in her mouth, because she's really trying. Yeah, she tried not to take the popsicle that time. So then we just do it again, maybe do another decoy round here. She's getting more confident about taking the stuff into her mouth again. So here, try again with the medicine. And sometimes she only takes one and I just can't get her to take the other one if I'm in a rush. If she's feeling okay that day, like not having any diarrhea or anything, I will just do the one popsicle. If she refuses the second one a couple times. But you see, the second time around, she took the popsicle. So we've gotten her to take both popsicles. The other alternative, if she's just not taking the popsicles and she's sitting on the rug like she's hungry, but maybe her tummy already hurts and she just doesn't want to take the popsicles, and this works for her meds as well. So if she's just completely refusing to take any of her medication before eating, but she's acting like she's hungry, especially if she tries to eat other things around the house like Kleenex, then we will crush her medications, her pills, put the pills in here. I'll send this along with you, and then close it and get it all the way down and kind of go back and forth like this. I usually turn it on the side so that the pills get really condensed in there and it can get crushed really good. Then I dump those pills out into a little bowl here. And then instead of the popsicles, this is the cyclosporin medication that I have prepared in those popsicles. So either you can melt a popsicle and put it with the pills, or you can take one of the pills out of the bubbles that I'll leave for you. I usually just take a knife and slice the side of it, making sure I don't get the pill. But these bubbles are really hard to open, so that's my trick to getting it open. Then I peel it open from the side. You can take the pill out, and then I'll send this poker along with you too. I find the seam where the seam in the pill is, and then I poke it right there all the way in, and then you could just squeeze the med into the bowl where the other meds are. So pretending this is a mixture that has all of her meds into it, I spoon it into the syringe, and I am careful to keep the syringe sideways so that meds are not, so none of the mixture is covering the opening to the top, because once I get it all in there, I'm going to condense it and push the air out, and I need that air to still go through that tube. So I'm gonna make sure and get all of the sauce, because that's really important, because there's, you know, medication in there. So I usually use like a small spoon like this and just kind of keep it sideways and get the medication in there. And then I usually make sure my finger is clean, and either use a finger or a spatula to get the rest of the medication off of the spoon into the syringe, to get the, you know, anything that went on the side of the syringe into the syringe. And I also get anything that's on the bowl, because you'll see you can get a lot with your finger, and that's really important because of, you know, making sure she gets all of the medication. So once everything is in the syringe, I carefully put the syringe plunger in, and once it's kind of, I can feel it's tight in there, then I flip it upside down and slowly push the plunger up until the air is gone. And you'll see that I got a little bit out of the top, so I usually kind of just rub that kind of back on the top so that when I put it in her mouth, she'll get it. Then to administer it, she has a tooth missing on this side, so it's very easy to pull. You'll see, okay, if you can come on this side, Mr. Cameraman, please. I'm going to take one hand and pull her lip up with my thumb. I'm gonna have the plunger ready like this so that my thumb is ready to do the plunger. And then I'll slide the syringe in. I only use these ones that have the soft top, and I can kind of go along until I feel where that tooth is missing, And then it's easy to slide it into her mouth and quick plunge it in, keeping it as close to the back of her throat as possible so she gets as much of that med. And you can see we got a lot of that med in there. There's still a little bit that she got out. So you can just kind of slide it around on the inside of her gum. And that's pretty good. I might still take the extra little bit here and just get it on the inside of the gum with my finger. And then she's gotten her meds. The way to clean these is, the easiest way that I do it is just to suck in the water as it's dripping out of the faucet. And you can get a pretty good amount of water. I mean, obviously you can take a cup and put water in it and then suck it up that way too if you want. And then you squirt it out. Do that a couple times. The plunger will be pretty clean. Then you'll take, or the whole syringe will be pretty clean. You'll take the plunger out. Rinse the plunger. And that's pretty much all I do for cleaning it. I have a little place where I hang it upside down or like this so that it air dries really well before I put it away. Thank you so much and good luck.